Good evening, everyone. My name is Amy. I'm a member of Next Niagara, and I'm pleased to welcome everyone here to Real Talk, Building Community Through Honest Conversation, a series presented by Next Niagara and the Niagara Region Anti-Racism Association. Real Talk aims to have real, honest, sometimes uncomfortable, yet really important conversations. In this session, we will begin to explore food security and scarcity here in Niagara. Nearly 60,000 people in Niagara are food insecure, and we know that food insecurity disproportionately affects our Indigenous community members. Together, we need to work to minimize this inequality. Before we begin, we would like to acknowledge that the land on which we gather is the traditional territory of Anishinaabe and Haudenosaunee peoples. We recognize and deeply appreciate their historic connection to this place. We also recognize the contributions of Métis, Inuit, and other Indigenous peoples, both in shaping and strengthening this region in particular, and our province and country as a whole. As I mentioned, this event is hosted by both Next Niagara and the NRARA. Next Niagara is a young professional council under the GNCC, committed to representing and amplifying the voice of the next generation in Niagara by creating opportunities for community engagement and empowerment. One of the ways we do that is through events like this. On behalf of the council, it's with great gratitude that we are able to offer this series through a partnership with our co-hosts, the NRARA, and sponsorship from the YMCA of Niagara. I would like to specifically thank the YMCA of Niagara Employment and Immigrant Services for making this event possible through their sponsorship. And it is my great pleasure to introduce Aaron Graybiel, General Manager of Community Outreach, Day Camp, Child and Youth Programs, to say a few words. Aaron, over to you.
Great, thank you. As mentioned, I'm Aaron Graybiel with the YMCA of Niagara. As many of you likely know, the YMCA is a charity dedicated to building healthy communities, and we are committed to nurturing the potential of children, youth, and families, promoting healthy living and fostering social responsibility within the community. We would like to extend our appreciation to GNCC and the Real Talk group for bringing such an important topic to the forefront. We look forward to tonight's panel and appreciate everyone's time tonight.
Thanks, Aaron. Thanks for joining us. I would now like to introduce Salah Waziruddin, who is an executive member of the Niagara Region Anti-Racism Association, our great partner, and chair of the City of St. Catharines Anti-Racism Advisory Committee. Salah, over to you.
Thanks very much, Amy. I'm Salah Waziruddin from the Niagara Region Anti-Racism Association, as Amy said, and just to introduce our organization a little bit. We have 5 main things we're working on. We have a police reform campaign, including ending racial profiling and adding body cameras. We have an employment equity campaign. We're trying to establish municipal anti-racism committees. We're involved in public workshops and discussions like Real Talk tonight with Next Niagara Council. And we also help individual cases with harassment or discrimination they're facing. We have 3 ongoing cases now from across the region. You can find us on Facebook at the NRARA or on the web at nrara.org. I just wanted to add, you'll hear later tonight about how Black households, for example, are 3.5 times more likely to be food insecure than white households, and Indigenous households are very close behind. But race even overrides other factors from what we found, what the research has found. Now, there's a report by Proof, which is Food Security Policy Research Group, and Food Share. And they found, for example, that Black homeowners have the same risk of food insecurity as white renters. And being Black or Indigenous determined food security in a way that overrode other factors like education, home ownership, immigration status, and income source. So even whether you're Canadian born or a newcomer, if you're Black, it didn't make a difference in what the kind of food security risk you faced. Thanks.
Thanks, Salah. Such important work the association is doing. We're so thrilled to be working with you all. It's now my great pleasure to introduce our speakers for this evening. We have 4 great panelists. We're going to have a great conversation. First up, we have Amanda Ali, who is our Food Security Project Coordinator for United Way Niagara. Amanda has always felt food is a perfect vector for connecting people, learning cultures, and promoting health. She channeled this into her schooling and work. With degrees, many degrees, Amanda, in biology, global health and nutrition, and international project management, Amanda has spent time in India, Kenya, and Canada managing emergency response, food security, nutrition, and health projects. She is now focusing her efforts at home to foster health and well-being in Niagara and build a more inclusive food system where everyone has access to affordable, healthy, and diverse food. We're certainly pleased to have you here. Next, we are fortunate to be joined by John Braithwaite, the CEO for the Hope Center in Welland. John has been married for 24 years to Miriam and has two wonderful adult children, Eve and Sam. He has spent his career working in the not-for-profit sector, working for both Boys and Girls Clubs, United Way, and most recently as the executive director of Big Brothers Big Sisters Niagara Falls. He is passionate about increasing supports for those most vulnerable in our community. We also have Erin Rising. Erin is the program coordinator for the Niagara Community Garden Network, a program of United Way Niagara. It is a collaborative network of organizations offering space, tools, and resources for people in Niagara to grow their own food. For over 20 years, Erin has been an avid gardener and educator for people of all ages to facilitate learning about the natural environment and health. Erin has a Bachelor of Arts in Sociology and Cultural Anthropology and formerly practiced as a licensed naturopathic doctor. She moved away from her practice to work directly with people in the community to advocate for making healthy food accessible for everyone. And lastly, we are joined by Brandon Agnew. Brandon is a community health broker with Public Health, Niagara Region Public Health. Working for Public Health in Niagara as a community health broker, Agnew specializes in a mix of social and community development work. It involves helping people struggling with poverty, especially through this pandemic. Super happy to have all of you joining us tonight. Thanks for coming out and lending your expertise. Before we begin our discussion, we did receive a number of questions from everyone in advance, and we've worked really hard to include each of these questions in our big list this evening. If you didn't have time to submit a question in advance, you can also submit it at any time during the chat at the bottom of your screen there. And we will do our absolute best to get to all of the questions, whether it's throughout the question period or at the end of the event. We have a little bit of time set aside. All right, and without further ado, I think it's time to just dive right in. So I think the best way to make sure we're all on the same page and coming from similar perspectives as we're using all of this terminology, Amanda, I'm hoping that you can provide us with a bit of a breakdown of what food security, food justice, food sovereignty, what those mean, and then we can kind of dive further into how this works in Niagara and all of that.
Definitely. Thanks, Amy. So yeah, there's a lot of these terms now that may be new for some people as this issue is sort of coming more to the forefront. So I think it's important for us to kind of semi-define these or explain what they are, because we'll be throwing them a lot throughout this conversation, just so you get a context and hopefully learn a bit more. So in terms of food security, it often is seen as more so of an income or just straight poverty issue. But when you look at the definition that the FAO provides, so the Food and Agriculture Organization, it's when all people at all times have physical and economic access to sufficient, safe, nutritious food to meet their dietary needs and food preferences in order to live a healthy and active life. So lots going on there for sure. But then when you talk more about food sovereignty and food justice, they sort of fit within that and complement it. So with food sovereignty, it's more rights-based. So you're looking at the right of people to healthy and culturally appropriate food that's produced through ecologically sound and sustainable methods, and their right to define their own food and agriculture systems. Then when you get to justice, it's more of the equity piece. So food justice seeks to ensure that the benefits and the risks of where, what, and how food is grown, produced, transported, distributed, accessed, and eaten are shared fairly. So a good summary of how they all sort of interconnect is food security can be seen as the overall goal of what we're aiming to achieve. Food sovereignty sort of describes how you get there, and food justice talks about transforming that system to make it more equitable, more fair, and eliminate disparities.
Thanks, Amanda. I think we're all going to do our best over the next hour to really break that down further and get a good understanding of what that looks like here. I know for anyone who received our pre-event emails, we had suggested to listen to a great podcast called Hard to Stomach. And one of the episodes, they referred to the Black Creek Community Garden, which is in the Toronto GTA area. And there's kind of some great context there on what food sovereignty is and what it looks like and how, we can achieve that in our communities. Highly recommend that for everyone listening here tonight. John, I want to toss it over to you. I'm hoping you can share with us, you've got a great team over at the Hope Center, what you all have witnessed lately and observed, and how you've seen food insecurity showing up in your workplace lately.
Thank you. And it's wonderful to be here. I appreciate being included in this conversation. And when I talk about sort of the things that are going on with our food bank, I can say with some certainty that we're seeing similar increases not only in our community in Welland, but across Niagara and across Ontario, because we're regularly in touch. But and unfortunately, it's going to be a lot of sort of going to sound doom and gloom, and I'm kind of tired of acting like this. But unfortunately, it's really important that people are aware. So since October 1st, and this is a statistic that really resonates with me, because we've had 117 people just since October 1st access the food bank for the very first time, including already so far 68 this month. And that really resonates with me, because I think to my own personal situation, as particularly when we were a young family and, at times struggled financially, and we are fortunate we didn't ever get to a point where we had to access a food bank. But, I can only imagine what that must feel like for a family to, kind of look around and say that, the only way I'm going to be able to feed my family and keep my utilities on is access a food bank. So, in Welland, there's been 117 people in the last 7 weeks that have had to make that choice. And we might see typically 20 to 25 new clients per month. So as you can see, it's highly elevated. The other thing we're seeing is, we're seeing an overall 20% increase in the number of people we've served if we look at the same period, even during COVID last year. But where I'm particularly concerned is in children. The number of kids we've served in that time frame is 351 kids, which is an increase of 33% over the same period last time. So that's telling me that there's a lot of families that are really struggling feeding they're putting food on their table and making sure they pay their bills. The other trend that we're seeing is a couple of trends. One, we're seeing a lot of people that haven't accessed the food bank in over 1,000 days, and that's just sort of something in our tracking that shows that they've accessed our food bank, but not in a significant period of time. So we can see that some tough times have returned. And the other area that I'm really concerned about is over that same period of time, when we're comparing, time period to time period, is we've seen twice as many working families accessing the food bank. So, that tells me that with food prices increasing and other commodities increasing, such as fuel and groceries and utilities, that it's really putting some stress on families to make sure that they are able to provide food and keep the lights on at the same time for their family.
Thanks, John. Yeah, it really shines a light, I think, on how broad it is affecting our community members and different groups of people, families, single parents, working families, etc. Brandon, and then Aaron, anything to add from your perspectives on what you've sort of seen lately, to give everyone a bit of an understanding of what that climate is like out there?
I really appreciate John bringing forward that those stats, that data, because the numbers don't lie. And I think that as we start to talk throughout this conversation about food. Ultimately, we'll probably just start talking more and more about income and income disparities. And so for me, when we talk about food security, it's rather synonymous with financial means and opportunity that creates or doesn't create across the lifespan. So I appreciate you bringing that forward. And I know, maybe just off the top too, to say, thank you, to echo John's thanks for the invitation, but more importantly, thank you for the panelists here and the hosts and everybody joining in to have this conversation. Amy, you prefaced off the top that it might be difficult at times, but the point is that we are having it. I think maybe with increased education and advocacy and enhanced collaboration and partnership, we could get to a better future. I'm supposing that that's the point of conversations like this. Yeah, fingers crossed.
I echo Brandon's sentiments. Thanks so much for hosting this tonight, and I look forward to seeing sort of what kind of movement might come of this conversation. I know from my work in community gardens, so I coordinate a network of organizations that have community garden programs, and so there's a broad range of different kinds of organizations that have these gardens. But I do know that across the board, the demand is quite high for garden space, higher than it's ever been in the past 2 years. And it's beyond our ability to accommodate everybody, unfortunately. So I will say that it is fortunate that in Niagara, most of the community gardens are coordinated by not-for-profit or social service agencies. And so they do prioritize making sure that there is space available for vulnerable or marginalized communities. So at least we know that the gardens are providing support to many families across Niagara, but we certainly do need more garden spaces established to help accommodate more people.
Thanks, Erin. I couldn't agree more. John, I want to reflect back on a little bit of the things. Thank you again for those numbers. I agree, numbers don't lie, and they're incredibly important. I'm sure in all of the work that each of you are doing. A lot of that, I'm sure, was very, very reflective of COVID-19, the pandemic that we've been seeing, but how specifically, or maybe you can just summarize for us what COVID has actually, how has that impacted those numbers? Do you believe that, those 117 more people, is that mostly a result of the pandemic that we're facing? Yeah, share a little bit about that for us.
Oh, I've got a couple of theories on that. Okay, sorry. I've got a couple of theories on what that may be. Certainly the end of a lot of the federal supports is a challenge, particularly, and the one that I think is probably the most responsible will be the end of the wage subsidy, because I think there was a lot of people that were able to be employed, unfortunately, probably precarious employment. So, hourly, not being able to predict the number of shifts you might get, lower wage. When that ended, I think that ended a lot of employment. And I think that's led to some people having to turn to a food bank. But I think, it's been a long time. It's been 20 months. So even if you, had some savings and now you're working, you're still recovering from the pandemic. And, one stat that I saw that really resonated with me and really showed me that, we're really, this pandemic has not impacted everybody equitably, is, the top quintile of earners in our province, when the pandemic hit, there were about 7% of those people who said they noticed a change in their disposable income. But the lowest quintile, there was close to 40% that noticed a change in their disposable income. So you can tell from that it has impacted everybody differently, but primarily those people that are in precarious employment, in lower wage jobs, those sorts of things. So that's been a real challenge, I think, has led to some people having to access the food bank for possibly the first time.
Absolutely, thank you. I know one of the big topics that we hear a lot about, at least especially in the chamber and all the industries that the GNCC works with, is sort of our supply chain and production. And we've seen huge disruptions in that from COVID-19, of course, and everyone is experiencing that in many different ways. But I think it was also maybe just shining a light on a pre-existing issue, or exacerbating that perhaps. And Erin, we received lots of questions before this event tonight on supply chain and, what are the effects on supply chain issues here in Niagara? What can we do to increase our reliance on local food and agriculture? And is there anything else that we can do to combat this? Erin, I'll let you share a little bit first. And if anyone else has this is such a big topic. So if anyone else has anything to share, we welcome that as well.
Yeah, so unfortunately, at certain times during this pandemic, we've definitely seen particular shelves at the grocery store that have been empty, and it's definitely signaling some disruptions in the food system. And I think it's kind of exposed the fragility of our current food system, our current model. I know currently, so right now we're shifting out of our growing season here in Niagara and in Canada. So the produce industry is warning, unfortunately, of some potential shortages due to the numerous different kinds of supply chain issues. And because in Canada, unfortunately, we are rated as the 4th highest importer of produce in the world, it's going to have major impacts over the coming months. So the manager of the Ontario Greenhouse Vegetable Growers has stated recently that we can soon start to feel the impact of these disruptions, unfortunately, and there may be certain things that we won't have available to us. And so some of those things are perishable items that might be sitting in a shipping container but can't be offloaded. He also warned that there may be times where, certain shelves are empty of particular items, but there may be, an abundance of something that just got offloaded off a shipping container that they're trying to get rid of at a really low cost before it spoils. So it's going to be a little bit bizarre over the coming months to see how this plays out, but definitely we need to sort of start to shift our focus towards local production and supporting local producers and growers. We're very fortunate to live here in Niagara where we can grow quite a lot of different kinds of crops. Obviously, there are certain restrictions that I think we're used to having available and abundant, like citrus fruit or avocados. But I think it's really important that we start to really reflect on how we eat and where do we get our food, and really start to think about our purchasing, because if we can continue to support local, of course, all of that investment goes back into our own economy, which is really important right now. Another thing we can do when possible, if you have the resources or the means, is just to try to grow your own food, of course. So you can actually grow a lot of food in very small amounts of spaces, and you don't need fancy containers or garden boxes. You can really grow, in potato sacks or buckets, even on balconies. We can even grow year-round things like microgreens and sprouts, which are actually a really good source of all kinds of nutrients and protein indoors, and again with very little means. So there's a lot you can do just to try to produce your own food with very limited resources. And then, of course, there are community gardens available theoretically when there is space. So for people who may want to grow for their family but maybe don't have a yard, maybe living in an apartment complex. I think this does create a larger need for education and skills building around how to grow food and learning how to preserve our own food. But I think we really do need to really shift gears and start to reflect on where we're purchasing, how we're eating, and think about our options and our means. And also, of course, if you do happen to have resources where you're able to grow food, ideally you're growing more than you need and sharing with others potentially in your community that aren't able to do so. And that's really helpful as well.
Thank you. Yeah, it makes me think of how many resources there are out there in Niagara, across Niagara. I live in St. Catharines myself, and I know the library every year offers seeds and different things to help people get started. I'm sure, Erin, I'm sharing everything you already know, but there's just there are resources out there for folks to get started, and it can, I'm sure, seem overwhelming of growing your own food in certain spaces, but such a great option for folks. Moving into sort of, we've got all of these folks joining us this evening. John and maybe Amanda as well, hoping you can chime in. Why why should the greater community be concerned about our rising food insecurity? John, you gave us the numbers. It's going up. There's only so many food banks. There's only so many, I just said there's lots of resources, but there are only so many resources and areas of support. Why, as a greater community, should we be concerned about this?
Well, I'm sure Amanda's got some good points in that. I know she's heavily involved in this area, but for us, the expression we like to use when we talk about food bank usage and it's rising is we talk about it like it's a canary in a coal mine, and while that might seem like a dated reference, but long ago when they didn't have the technology, people that were working at coal mines would have a canary in a cage, and if the canary died, that meant the air quality wasn't good, and they needed to get out. And so it's an indicator of bigger issues to come, and that's how we look at it. People that are struggling to make sure that they pay their hydro bill, make sure that they're able to pay for their transportation needs, keep a roof over their head. Those things all get paid before food goes on the table. And when people are having trouble putting food on the table, it shows that they're having other issues. And generally speaking, it's gonna lead to other issues down the road that we all need to be concerned about. I mean, poverty costs us in Canada between 70 and 80 billion dollars a year, which is a huge amount of money. And that's one of, if we end up with people having to rely on shelters, for example, or support in paying their utility bills, those cost us all significantly more down the road than they do if we're able to just meet their needs and they're able to access healthy food without accessing a food bank.
Yeah, just to kind of jump off of what John was saying, there's definitely the kind of that trickle down effect, and it's so intersectional. I mean, when I read that definition, there's so many aspects to food security, and there's so many things that come into play with what causes food security and then what that in turn can cause. So for example, like your health, how that can become affected, and we now are seeing these disasters that are happening that are affecting the supply chain. So as you may feel food secure yourself, it only takes a pandemic for things to completely flip the switch, and you realize how vulnerable things are and how interconnected the mental health, your housing and affordability, employment and job security, how all of those play a role into food security as a whole. And so it's important overall, as a population, as a country, globally, right down to your community, into your own household, to take those things into consideration, because it'll affect you one way or the other, whether how severe. Hopefully it's not too severe, but how severe or what it looks like will differ, but it will definitely impact you one way or the other.
Fantastic. Thank you. Thank you both so much. Amanda, don't go far away. You were talking about health, and I really want to dive in. I know that's such a big component or effect of food insecurity across our community. And so what does food insecurity and its effects on our healthcare system look like? How does it affect our healthcare system?
Yeah, that's a really good question, because in terms of the healthcare system specifically, like different from public health and social determinants of health. So social determinant of health, meaning like food insecurity, is a social determinant of health in that it can lead to other chronic disease illnesses. It can basically determine or contribute significantly to your health outcomes, individually and up to the population level. And so that's things like, if you consider not eating enough food, period, you're malnourished, leads to a number of health issues and disease, high stress and mental health issues, developmental issues in kids. So that's as a social determinant of health, of how it plays in. But with the healthcare system, it's funny, there's not a whole lot of research that's been done, but it's now being done because people are starting to realize the connection that food insecurity is actually a factor into the healthcare costs. And so Proof did some research, and I found some interesting stats that they have here that I'll share in terms of how food insecurity of patients affects the acute care. So acute care meaning more of like your short-term type of care treatment, if you have, emergency runs to the hospitals, day surgeries, that type of thing, as opposed to a chronic care, chronic disease like asthma or osteoporosis or something like that. So they looked at those who are marginally insecure, moderately insecure, and severely insecure in terms of food, and compared it to sort of the secure side of things, and found that the odds of being admitted into acute care ranged from 26 to 69% higher for those who are food insecure. And then on top of that, what that leads to is those stays in the hospitals were 1.5 to 2 days longer on average for those who are food insecure compared to the food secure groups. And that leads into an extra cost annually per person of between $400 and $565. So you can take that, that's just from being food insecure. They separated out other cofactors and other determinants as well. So that was just food security alone, showing an impact on the cost essentially of healthcare. And they've said basically that from what it looks like, that programming that helps target food insecurity, policies that provide, whether it's things like our child benefits or family benefits, and wages and income policies that help with your money and your financial status, along with other social systems and other just programming, community-based or whatnot, can actually help prevent some of these issues later on. So you see another study that was in the Canadian Medical Association Journal, they found that there was like a steady increase just in line of the cost of healthcare, in line with when they saw rising food insecurity as well. So a direct impact financially, let alone those are people's lives, that's their health that we're talking about as well. So that in and of itself is its own issue too.
Thank you. I have so many things to say. We look at, there's all of this lacking research and information. I think it really shines a light on how intersectional all of this is. And I know to the next generation, our attendees here tonight, that's something that's so important and so aware of as a generation, of how these things are all connected and there's no simple answer, which is why these conversations are so important. But it makes me think, Amanda, about, you said there's not very much research happening, and so or to rely on. And I think, as John kind of pointed out earlier, we need these numbers, and we rely on numbers and information to really guide change and policy and all of these things. So Erin, when we look at food insecurity and scarcity in general, knowing that there's limited research and there's big definitions and all of these things, do we see any sort of invisibility to the issue itself?
Yeah, I mean, I think John can probably speak further to this, but I think, I think we can all agree that during times of economic hardships or when we're struggling, we often don't talk about some of the struggles that we're faced with. So I do think that there's, this is a really widespread issue, but it can be largely invisible to the general population. So, the average person who's relying on emergency food banks or other meal programs are probably not sharing it with people even in their family or others in their community. And, of course, this predates COVID. People have been vulnerable and unable to afford food and other necessities predating this. But of course, this is all exacerbated right now. And of course, there's also an issue where you know, Amanda sort of touched on different levels of food insecurity, but there's also people within our communities who may not classify as food insecure in terms of statistics, but they may still be struggling and have hidden sort of food stress, or maybe are choosing poorer quality foods because they're not able to afford things that may be more nutritious or higher quality. I know that there are particular populations as well where we do tend to see a lot more of this invisibility. So students is a really good example of that, where they may be living on student loans and are going to school a lot. Maybe they have a part-time job, but still have like the same cost of living, for example. Children may be going to school without having a nutritious breakfast. Seniors may be living on a fixed income. There may be newcomers who don't know how, or maybe there are language barriers to them accessing food programs, or maybe they're not aware of them. And then of course, there's the income issue, which I think we're going to touch on more, but the low wage workers. So a large proportion of the people who do rely on food bank actually often have jobs. I think they say 85% have an adult in the household who have a job, but they may have, you know, potentially low wages. So there's definitely an invisibility factor.
Thank you. I'm going to share a quote. For anyone who hasn't read or seen the lived experience engagement report on findings from the Niagara Food Security Network, it will be one of the resources shared with everyone later after the event via email. And as I really found that the report did a great job of highlighting specific individuals and families and issues that our community members are facing right here in Niagara. It's so relevant. And one of the survey or focus group attendees said, in quote, "I am filled with anxiety and sadness when I cannot afford to feed my daughter. I have bills that are large enough to not allow me to keep food in my house." John touched on this earlier about, you know, food is one of the last things that gets paid in terms of bills and, you know, having a roof over your head and those sorts of things. So there's my very large preamble I want to talk a little bit about children and their health. We see a lot of, I don't have a statistic, but I know that it's mostly families that are food insecure. And so Brandon, can you share with us a little bit about how food insecurity affects children, how it affects their health, all of that?
Yeah. So yeah, thank you for everything that's been shared and asked to be shared up until this point. You know, to Amanda and Aaron's point around data and reliable data, like the pandemic has definitely thrown the curveball of all curveballs. So anecdotally, you know, what people like John and his team are seeing is super important. I was able to reference a Center for Addiction and Mental Health survey that's been running since 1977, every 2 years. So it's a pretty reliable and longstanding data set. And, you know, generally speaking, what we know is healthier students learn better, and that better education leads to better health, full stop. And so to Amanda's point earlier around the intersectionality of all these things, and Amy, to your question around why should people care, yeah, maybe you don't care about food and food insecurity, but maybe you're really passionate about mental health. Well, there's a direct linkage there. And so you know, maybe you're a housing advocate, and there's a direct linkage there, et cetera, et cetera. So like throughout the survey, the last one of which was conducted in 2019, what we know locally is that students who self-report feeling as though they fall on the bottom end of the social economic ladder, so it's all self-reporting, have worse health outcomes just about across the board on any question that's being asked. And you're looking at age groups of people that you can fast forward 20, 30, 40, 50 years, and the, you know, started to vape earlier, started to smoke earlier, started to use cannabis earlier, started to use alcohol earlier, reports of self-harm, psychological distress, attempted to die by suicide, whatever it might be, the canary in the coal mine is the data that we know at that age group, whether it's 11, 12, 13, 14, 15 years old, that then, manifest into chronic disease, or sometimes earlier in life, sometimes later in life, but usually earlier than sort of the expectancy in Canada. And we all bear those costs as well. So food insecurity. So it's asking kids basically in order to determine that if they've gone to bed hungry, and then never, sometimes, or often, basically. And we have, quite a few kids from the sample size students in Niagara that are reporting that this is a frequent and ongoing occurrence in their lives, that they're going to bed hungry. And then we can kind of connect the dots from there. And again, those health outcomes in that short period of time, you can sort of extrapolate over the next 20 to 50 years. And that becomes all those economic sort of mentions around loss of productivity, healthcare costs that have to get absorbed, et cetera, et cetera. But essentially, we're talking about, to go back to what Amanda prefaced, everything on, we're talking about people's rights being denied. And so maybe that is a call, I think, maybe for the next generation to hear louder than maybe my generation, that this is about justice, and it is about suffering, and ultimately a lot of this can be changed and alleviated through policy.
Just if you don't mind, a quick point to add on to Brandon's. We talk about data and how important it is, but I will say this: children in the Niagara region make up about 20% of the population. Yet at the Hope Center, they're about a third of those that are accessing our food bank. So they're significantly overrepresented in those that are accessing the food bank, which, tells me that we've got a lot of families that are struggling right now.
Thanks, John. Thanks, Brandon. You brilliantly portrayed for us how, this creates a cyclical and generational and long-term impacts on our community members, and what opportunities they have available to them down the road in so many different facets. We're talking about, food justice and food sovereignty, and having, not just access to food, but access to healthy food and food that you want. And so, Erin, I'm hoping you can share with us some tangible resources. This is a question we got from an attendee earlier on tangible resources that our community members who are living below the poverty line to receive fresh produce, good food, when we're talking about the food that they want, the food that they deserve. What resources are there for them to access? And then I'm sure everyone here has something to chime in if Erin doesn't. I don't expect you to hit all of the resources there, Erin.
Right. Well, I will say that there's definitely been a push with the local food banks to incorporate more fresh produce, which is really wonderful. So they're getting more developments in terms of refrigeration and things like that. So there's a lot more for people who are relying on emergency food relief to be able to actually access a lot of fresh produce, which is wonderful. There's a program that a colleague of mine through Links for Greener Learning is running called the Good Food Box, where they actually distribute produce at a low cost to different areas in the community, and it's very affordable. And they even donate a certain number of boxes to people who can't afford it at all. There's a project that Amanda and I are working on right now in partnership with Public Health, where we are hoping to set up some pop-up produce markets in high priority neighborhoods next year. We did pilot it in the fall and it went really well, where we were going into Niagara regional housing communities and setting up a market stand. And it was really lovely space, very dignified way to sort of access fresh produce. And it was sort of a pay what you can model. So we're hoping that we can grow that so that we can sort of expand it through the region. And, if there are partnerships we can develop with local farmers who may have excess produce. Amanda and I did a presentation earlier today, and we just happened to be in a room with farmers in Niagara on the Lake who said, they know other farmers who were plowing over butternut squash, and they just have abundance at certain periods of time. And unfortunately right now, because the logistics or the supply chain disruptions are happening, they don't know what to do with it or how to get it into the hands of people if they can't sell it. So we're hoping to sort of develop this logistical model where we can actually bring it into communities, as well as, again, the Good Food Box is a really great resource I'd refer.
That's fantastic. Thank you. We actually received another question from one of our attendees through the chat while we're talking about sort of accessing food and costs and all of that. And the question is, has produce being produced in greenhouses increased? Have we seen an increase in that at all? And or is that seen as too costly when grocery chains, we know how much buying power and control they seem to have when they go to purchase it in bulk. So Aaron, I'm not sure if this one's for you or anyone, feel free to chime in. Or if perhaps we don't have the answer and it's definitely an option to follow up, because it's a good question.
Yeah, it is a good question. I unfortunately, I'm not aware, unfortunately, of what the answer is, if they've ramped up production or scaled it back based on, what's going on right now. I'm really not too sure, unfortunately.
No problem. And I think this second question, we can see about the stores and that sort of waste kind of refiltering into our communities. I do know, so there's a follow-up question about the bulk grocer, the big grocery stores, the big chain stores, repurposing food that they're not going to use. I know personally, a small thing that I use in my life is an app called Flash Food, and it's precisely that. So there's a number of stores that are using this within the communities that have food discounted that is about to expire. It's not yet expired, and it's highly discounted. And so a small thing, it's not through the food stores themselves, but is a sort of, I think we see those small stepping stones or those blocks that we need to see so that those big chain stores are really seeing what we need. Does anyone have anything to add in on that? If not, I will move forward.
I can say that the local grocery stores and particularly Costco is really good to the food banks here in Niagara. But the challenge is that we get the produce when it's about to expire, and we get it in a significant bulk. So sometimes it's a real challenge for us to distribute it in quickly enough that it can be useful also for those people that get it. They don't have to cook it the second you get home. So, I'm sure that's probably a solvable issue. I know we work very closely together. I'll tell you, Betty Lou at Community Care, they get big shipments from Costco, and they do a good job of sharing that throughout the community. But it doesn't change the fact that, you've got a day or two to distribute it out into the community before it goes bad. So, that's a bit of a challenge with produce.
Any advice from any of you for people who are joining us tonight on what how to approach these massive businesses that perhaps don't appear to care, or how do we have that impact? What can we do?
I mean, it could be as, a curious little thing as you're checking out and you're engaged with staff there, to just ask some questions that feel comfortable to you around food waste, around their level of generosity. John's point is pretty astute in that, like, if we're living in a society that is kind of giving people things 12 hours before they fully expire, then perhaps we're not putting our best foot forward. Innovation in this sort of arena would be great, but like the non-for-profit sector is underfunded and overburdened 1,000% of the time, and then you add a pandemic to it, and it makes things more difficult for the staff and the donors and people themselves. So that's super tricky. And Amy, to your point about the Flip app, like, I've heard from people that they use that. it's great. We talk a lot too. Amanda referenced, or Aaron referenced the pop-up produce markets, and that's a pretty big variable for making sure that food can be affordable but also attainable and getting it to people, because people will often talk about how getting to a grocery store that they can afford to shop at is 2 bus rides away, how much time that takes, 3 kids in tow, et cetera, et cetera, et cetera. And so that's one small thing that we've been able to do. But yeah, I would say if this is something you're passionate about, you'll probably find an ice-breaking question to maybe ask a staff at a grocery store, or maybe somebody that does sort of this line of work, just to kind of broach the conversation. And if you have follow-up, then it'd be great to share it through a channel like this, and maybe some sort of special project or advocacy work could spawn from that. It's the sky's the limit in terms of opportunity to be more efficient and dignified with all of this, for sure.
And one of the things that we're excited about at the Hope Center is we just launched and developed an app, that has all the information about the Hope Center. It's there, available at a glance, and it also allows push messaging. And so next year, when we start to get into situations where we have excess produce that we need to get into people's homes quickly, we're going to experiment with using push notifications to people that have downloaded the app, and just tell them, if you come today, we've got this. And so we're hopeful that that's going to be something that will help us move the food from the grocery store to the Hope Center to somebody's home where it's usable.
Brilliant.
Amy, can I say as well, you talked earlier about engagement and empowerment as like sort of 2 core values, and I think that's an interesting one. And I know Aaron and Amanda have done some really great work in this regard of trying to form partnerships all the way through the food system locally. It's so curious that there would be farmers that have a surplus of really great local produce, and yet the problem to be solved is how to get it to the people that would benefit from it the most. So the analogy of sending people to the moon and all this seems like a solvable thing. It maybe they're partnerships that historically haven't seen sort of sitting down with one another. And John's mention of the app is great. I think it was Food Share started a pilot project between Niagara, I want to say Peterborough or Kingston, and I want to say somewhere like Milton, but they were looking at that. If you have food to donate, upload it here to this database. If you're running a food service and you can accept some food, but then we get into potentially some logistical challenges around like storage, distribution, not having freezer space, not being able to process it in a timely and safe way to get it out. So solvable problems 100%, but problems in the here and now nonetheless.
Absolutely. Amanda?
Yeah, I just wanted to say, like, hearing everyone talk, I hope it highlights for everyone joining us today that how innovation can really help across kind of industries and sectors. Like we see here how that tech mobile apps are playing a significant role here, or can play a significant role in connecting farmers with people who are logistics, who maybe are your shipping and truckers, and how that's a super important thing to consider, that it's not just kind of like sometimes we can be quite siloed in our approaches, saying this is a ministry of X issue or this industry issue, but it's really, it takes everyone to interconnect the entire system. And then another point, just to build on to things that people can do to kind of help make these changes, along with what Brandon sort of mentioned, is sometimes you need that top down as well as the bottom up. So those policy changes, so advocate to your local governments, however you can, your MPs, MPPs, and bring these issues into play, because over in Europe, they're quite progressive with a lot of their food waste policies, and basically saying you're not allowed to do it to grocery stores, markets, restaurants, and such. So it's possible, like Brandon said, we can do it. It's just a matter of kind of working it into our system here in Niagara and Canada in general.
Absolutely. I'm really hoping that some of my friends on Next Niagara are joining us tonight. We have some different committees on the council, one being our advocacy committee, and I'm hoping they're vigorously taking notes right now on how we can help lend a further hand, taking away from this conversation on making some of that change and perhaps being that group for our generation. We're hosting this conversation because it's important. And so let's take it that step further. Excellent. Amanda, you were just speaking about, being siloed, and everyone here has mentioned the intersectionality of this issue. And I mentioned earlier about how disproportionately affected Indigenous community members are. Salah mentioned Black communities in Canada are 3.5 times more likely to experience food insecurity than white Canadians. 3.5 times more likely, folks. That's not a small number. And so everyone, Brandon, I'm going to toss it over to you on how minorities in our community are disproportionately affected by this issue, and how does this tie into greater issues of racism and inequality for our BIPOC community members? I know this is a huge issue, and we see it in all facets of life, but really kind of connecting the dots here on racism, anti-racism, and food insecurity and how it affects our neighbors.
Okay, I'll answer as best as I can, which is to say I'm not the best person to even make an attempt here. But I will say, to nobody's surprise, that historically Niagara has been a very white place. And just in referencing, again, this CAMH survey continues to be white, but we're starting to see that it's trending towards not being more diverse. I think the most comfortable way for me to answer this would be to go back to the idea of engagement and empowerment. And I think that those disparities are real, and they are also, again, they're born out of, systemic attitudes and beliefs. And we've seen a big call to question and challenge and overturn that and build a better extended community over the last few years in particular. And the thing that I see that's potentially the most promising, that kind of brings it back directly to food, in terms of something that's encouraging to people, would just the element of first voice and lived experience. And I feel like I'm not the best person to answer this because, I have a pretty stable, privileged life, as a white settler here. But what I try to do through my work and the platform that my work has through public health is to not speak for other people and to look at communities as not necessarily being devoid of skills or competencies or talents or passions, but being designed with a limited access to opportunity and resource. And I'm sort of like tiptoeing around giving any more of a direct answer, because I think that it's all born out of the same sort of mindset of superiority and sort of this sense of being better than, or providing for, doing for. And I have to sort of like try to challenge myself on a daily basis to say, like, when I'm doing community-based work, what are the solutions that this community is identifying as being quintessential to their health and well-being, full stop. My job is to sometimes animate that, to facilitate a process within that, or to advocate back through communities like the Poverty Reduction Network or the Community Garden Network. And so it is about providing opportunity, I think, for people. And when we look at food, really the sky is the limit when we then get into things that we could have better instituted locally, like maybe social procurement policies, where we actually say, hey, major institutions, where are you spending your money versus where should you be spending your money to have the biggest impact locally, and social enterprise opportunities as well, so that we don't perpetuate a charity model of just giving people enough just to get by, but we actually say we're going to invest in really targeted and intentional and prioritized ways to groups like the Black, Indigenous, people of color groups that you mentioned off the top here, Amy, that have historically been denied those opportunities. So I don't know if that's a sufficient answer, but it's probably the most, honest one that I could give.
I certainly appreciate that. And I just to add on to your remarks there, Brandon, anyone listening in, I certainly recommend, we heard from Sala at the beginning of the event, and recommend reaching out to that association and the work that they're doing and the connections they have in the community to truly move the mark on the issues that you're facing. Please don't hesitate to reach out. We're happy to connect you and assist in that that conversation. Tackling big concepts here, folks. Somewhat of a controversial topic, being that's getting quite a bit of conversation, especially after having the CERB in the past year and a half with the pandemic. But we've mentioned tonight here, it's very clear and widely known that food insecurity is basically at its roots an income problem. And so I'm just going to ask straight up, is universal basic income the answer? If not, what are the answers? Or perhaps it is. John, I'm going to start with you, and then perhaps there's other thoughts as well.
Well, let's talk about CERB, because it was probably the quickest benefit ever rolled out by a federal or provincial government. They rolled it out very quickly. It was easy for people to access. And so there was a lot of credit for it. And right off the bat, the food banks across Canada saw a decrease in the number of people accessing our food banks. And it wasn't until about June or July where we started to see it slowly climb back up. So that means, that a lot of people, rather than having to rely on a food bank, they're able to go grocery shopping themselves, which ultimately, from my perspective, it's about dignity and choice. And I didn't struggle with that. I was surprised that we saw, a drop in food bank usage initially, but I was pleased because obviously, I would love it if somebody, if we're able to be put out of business, because, I think that a food bank is really just a crutch. It's a Band-Aid on a bigger issue. But when we talk about how we treat other portions of the population, so I found it really interesting that the $2,000 amount was chosen, because if you're a single person on Ontario Works, or you're going to receive $733 a month. If you're on disability, you're going to receive $1,171 a month. And quite honestly, we're setting people up for failure. There's no way in today's society that if you're a single adult, that you can live on $733 a month without a lot of help from a lot of other people. And so really it's the provincial government offloading extra services to charities and ultimately to the public, because it's the public that supports us. So I believe that it's time to experiment with a universal basic income. I mean, they estimate that it would lift 3.2 million Canadians out of poverty. That's huge. And I think our goal as a society should be nobody lives in poverty. So if we can immediately lift over 3 million people out of poverty, I think that we should do it. And I know that there was some studies that have been very favorable. Unfortunately, the provincial government canceled the study that was going on in the Hamilton area, but the early results were that people were able to pursue education. They were able to find safe housing. A lot of things that many of us take for granted. So my personal opinion is that absolutely, I think it's time to do something like that. I think I always go back to sort of the saying that a society is judged by how they treat their most vulnerable, and quite honestly, in Ontario, we don't do a very good job of treating our most vulnerable. So I think it's about time to do this. And I just want to preface that by saying that's John Braithwaite speaking, not the Hope Center.
Thanks, John. Amanda?
Yeah, I just wanted to jump on and say, in addition to that, the living wage, to consider the equity and fairness aspect, because you can have your living wage set at X amount of dollars. So on paper, you're like, great, we're hitting this target. but who is actually making that? And to tie back into what Brandon was talking about earlier with who's the most vulnerable in our communities and the racism that comes into play there, we see who typically tends to make above, at, and below that living wage amount or whatever the minimum wage amount is. So that's an important thing to take into consideration as well, that sort of embedded sort of structural racism aspect that we've seen come out, rear its ugly head, unfortunately, very recently.
Absolutely. Thank you. All right. I want to we've got 10 minutes left. I told you the time would fly by. I just want to remind our attendees, if you do have any outstanding questions, thank you for those of you who've been sending them in the chat, but last few minutes to send them in, or we'll certainly connect you with our speakers after the event. But we've got a few more questions. So I want to spend the last few minutes with you all really talking about looking forward and what's happening right now, but also what can we do in the future and what does it look like in Niagara in the future. Brandon, I'm just going to start with you and hoping you, and of course anyone else who wants to speak to this, on what our local governments are doing to assist with food insecurity in Niagara at this time. We do have a provincial election coming up in the not so distant future. And that of course trickles down municipal level. I'm going to stop rambling. What can the local government do to assist with food insecurity?
I mean, yeah, I don't know much about how politics work, but I feel like John was onto something there with the downgrading of these issues becoming more sort of localized over the years. And we haven't had, significant or substantial social assistance reform in 30 years or so. So it is a math problem for people. And we can see as recently as probably today or within the last 72 hours, articles talking about rising costs, inflation being at all-time highs, supply chain issues, like things are getting worse. We haven't talked about climate change at all, but there's definitely an intersect between, the ability to grow food, et cetera, et cetera, et cetera. So what can or what are local governments doing? I would say maybe tune in to, committee meetings, if that's something that you're interested in, check it out yourself. From some of the work that I'm involved in through public health, I know that there was a recent 10-year study on the Niagara Prosperity Initiative that was done over the course of just about 3 years by Brock University. It essentially looked at the Niagara Prosperity Initiative's first 10 years, which was a $1.5 million anti-poverty sort of pool of money, and basically looked at how well that money was spent. What can we start, stop, continue? That might be something that a group like this or one of the priority tables is interested in sort of diving through and sort of understanding a bit more. There were some recent sort of announcements from that community services at the region would be sort of moving some of those pieces in-house. And one of the major recommendations from Brock was the creation of an actual poverty plan. Amanda talked earlier about siloed attempts and the need for this to be more coordinated and better supported. The hope there is that this moves that in that direction to avoid redundancies, to create efficiencies. I'm not a business guy. I'm trying to use business language right now. Is that what business people say? Create efficiencies, but to create opportunities for people. So to get food out, good food, safe food, culturally appropriate food, but also within that, just to double down on sort of the last few remarks that I made, but within that to create opportunities for people to showcase who they are, to showcase their ethnicities, their cultures, to help build, job readiness, to inspire people to get passionate about food. Like, of all places in Canada, the Niagara region should be able to do this exceedingly well. So yeah, that's just kind of a little bit that maybe crossed my desk through my work. Yeah.
Perfect. Thank you. In the essence of time, I'd like to spend the last few minutes. I'm going to hand the mic over to each of you consecutively and just sharing with everyone here what the community can do moving forward, how we can have a positive impact, what this looks like looking ahead. John, I know you're afraid to be doom and gloom in your words, but we're all here for a reason. I think lay it out for us, tell us, and you each have your own pillars of work and areas, what the community can do to have that positive impact and support, and what it looks like looking ahead. So Erin, I'm going to start off with you.
Okay, I mean, I'm just going to speak very broadly, but I think it's really important, to just learn about the different organizations that are within your own community that are doing this kind of work, and maybe engage them and figure out whether there's an opportunity for you to donate resources or your time to that cause if you so feel like doing so. The Food Security Network has created an asset mapping tool, a food asset mapping tool. So you can actually look at the map of your own community and see what kinds of resources exist. And that would include things like food banks, emergency meal programs, community gardens, for example. So that's a really good opportunity just to do something within your own particular neighborhood or community. And then of course, obviously I'm a big advocate of growing food locally. And so I think, if there's any opportunity for you to grow more than you need and donate that to your neighbors or to anybody that you happen to know that might be struggling, I think that's really impactful. And, even on a broader level, start a community garden if you're able to, if you have access to land, engage people within your community that might be interested in partnering and collaborating on that.
Thanks, Erin. John?
Well, I don't want to, talk too much about data and all that kind of stuff because we've done that. But, Brandon referenced inflation rates. In the past 5 years, we haven't had a month, or we had 1 month a few years ago where the inflation rate was 3%. And then next thing you know, we see August is 4.1%, September's 4.4%, October's 4.7%. It's trending in the wrong direction. And so, as the cost of groceries rise, and we talk about, supply chains influencing costs and availability. I guess my biggest message to everybody is that, as we move through this long tunnel that has been this pandemic, many of us are going to be looking at COVID in our rearview mirrors and starting to get back to what we're more used to. But for those people that are most vulnerable in our community, they're not going to have that luxury. It's going to be a couple of more years before they start to see some improvements in their situation. Sylvain Charlebois is a senior director at AgroFood Analytics Lab at Dal University at Tallahassee. And one of the things he said, which really resonated with me, is he said, it's like we're in the third inning of a 9-inning baseball game. So we've got some innings ahead of us, some months ahead of us of increased food costs and challenges. And my message to people, and this has sort of been my theme over the last while, because I've seen just a lot of frustration and anger out there in our community because, for various reasons, whether it's, vaccine mandates or so on, or various pandemic related things, is have some empathy. Empathy is one thing that I see, there's a lot of empathy out there in our community, but there's also a lot of empathy lacking. And I think we all have to, start to be thinking about, if we were wearing those shoes, how would we feel, and what can we do to make a difference?
Thanks, John. Amanda, biggest takeaway piece of offering you have for our attendees here tonight, and then Brandon, I promise we'll have time to get to you quickly.
Mine, I get kind of broad, but it's basically just listening to those in your community, anyone who's in that marginalized population category. Figure out, why are they marginalized? Is it the system? Is it policies? Like, people aren't marginalizing themselves usually. So just listen, because oftentimes the answers, the solutions are there, and it's just a matter of, like we talked about earlier, getting the right players and the right connections to work.
Thank you. Brandon?
Yeah, just be kind. Just
Amazing.
be kind. Yeah.
I love it. We've got empathy, be kind, listen to others. Thank you to the four of you so very much for joining us tonight. I think we probably could have talked for a whole other hour, but we've certainly left everyone with amazing things to think about and actionable items that we can move forward on. Thank you to everyone in attendance tonight and who's listening afterwards for showing up and having this real talk with us. We challenge you to take all of this information as a call to action. Keep the conversation going, please, with your family, with your community, with your friends, at your work. Resources will be shared with all of you following the event on local organizations that you can support, along with podcasts and reading recommendations, similar to what Brandon shared in the chat there. You've certainly taken an important step by being part of tonight's conversation. And as we head into this upcoming holiday season, it's really important to recognize that this time of year is drastically more difficult for many of our neighbors around us. And we encourage you to support your community in any way that you have the means. Thank you again to YMCA of Niagara for their support and total assurance in hosting these important conversations. Thank you all again for joining us. We hope to meet you again at our next session in 2022. And until then, follow along at the Next Niagara and NRARA social media channels for upcoming news and events. Have a great evening, everyone.